we've been saying this for a very long time, the acute phase of the pandemic that's been associated with the tragedy of deaths and hospitalizations, that can end in 2022. And we hope that is the end game here.
That was the WHO's Emergencies Program Director, with maybe a glimpse of a light at the end of a long pandemic. If the acute phase of the pandemic ends in 22, then what comes next? And could Omicron be the turning point? Let's bring in two infectious disease specialists, Drs. Zain Chagla and Dr. Sumon Chakrabarti. Hi to both of you. Thanks for being with us tonight. Dr. Chakrabarti, I'll start with you. Omicron feels a bit different than the variants that came before. Is this the beginning of the end? Can we be a little bit optimistic as we head into this new year?
Well, as you guys know, I'm an optimist by nature, but I am very cautiously optimistic about Omicron. When it came on the scene, its remarkable ability to be able to spread so quickly to so many people, was important to look at. And it really brings along with it immunity, and that's our key out of the pandemic. And I think the degree of immunity that can be obtained by being exposed to Omicron for so many people, I think, is going to really change the way it transmits in the community to a more stable, low level. So I do think this could be the start of that. Obviously, I don't have a crystal ball, but let's see what happens. I suspect this is going to start in early 2022.
Dr. Chagla, we keep hearing the term endemic phase. What does that actually mean?
Yeah, so, an endemic is where you have stable transmission within a geographical region that, is within some sort of containment or some sort of barrier for which, we expect certain rates. So we have stable transmissions of influenza. We have stable transmissions of other respiratory viruses. We see a little bit of variation year to year. It's not necessarily a straight line. People get infected more in the winter than the summer, but they fall within a range of what we think is normal. And so, this is where we will likely end up with COVID-19. There are going to be infections every year. They'll fall likely more in the winter than the summer. But they won't see these explosive growth rates. They'll see, a contained range, particularly in the healthcare system.
Okay, Dr. Chakrabarti, we've been reporting on case counts for almost 2 years, but at this point in the pandemic, is that the metric we should be paying attention to?
This has been a source of frustration for me that we have so much stock in the case count. And I think that as time has gone on, this has become much less and less informative, especially now that it has uncoupled largely with the most important metrics for me, which is hospitalizations, and more specifically, people who are hospitalized for COVID as opposed to with COVID. And within this count is also those who are in ICU. I think looking at these metrics is going to be much more informative of what the true issue is, the true strain is on our healthcare system, because that's really what's been under fire for the past 2 years. So I think that while the case count does give some information, it's much less informative than hospitalizations and ICU thing, and that's exactly what I've been looking at.
Dr. Chagla, inevitably there will be another variant after Omicron. Can we expect it to be even milder, or is it possible that we end up going in the other direction?
Yeah, there's lots of lineages where this virus can spread and change, whether it's the Delta lineage, whether it's the Omicron lineage, whether it's some other lineage we don't even know of yet. What I will say, though, is what Dr. Chakrabarti has mentioned is immunity is going to give us some protection, right? And the fact that many of our populations are getting vaccinated, we do need to do a better job in some places in the world. The fact that, unfortunately, Omicron is going to affect a lot of people, but that immunity that comes from Omicron is also going to reinforce that immunity, is going to give us a very different ability to react to a new variant. And again, it will be a very, very high bar to pass for a variant to be much more severe, to be able to pass through that many layers of immunity.
Okay, Dr. Chakrabarti, the last and very big question, of course, not a lot of time to answer it. When can we know if this pandemic is officially over? And I know you don't have a crystal ball, but how soon could that be?
Yeah, it's tough, but long and short of it, it's going to be a combination of metrics like we talked about, case rates, etc., but also a sociopolitical profile where we look at getting lifting of mandates, not having capacity limits. All of these things together will mark the end of the pandemic. It's not going to be a single day or a single week, but something that gradually happens over time, though I do suspect that this is hopefully going to happen at some point in early 2022.
Right. Dr. Zain Chagla, Dr. Sumon Chakrabarti, both infectious disease specialists. Thanks so much for your insights tonight.
Thanks,
all the best.